Hello and welcome back to Muscle Monday. My name is Eleanor and I am the massage therapist at Pinpoint Massage and Bodywork. And today we're going to be talking about the latissimus dorsi. Now, the latissimus dorsi or the lats, this is a really big muscle. It's right here in our lower back. Um, this is the most superficial or the most outside muscle of the lower back. And this muscle is the one that gives swimmers like Michael Phelps that absolutely gorgeous, like V shape to their upper body. Um, so um, Pretty big muscle. It does quite a bit. Now let's isolate this one out so we can look just at the muscle and where this is attaching to. So this actually is going to attach here at T7 all the way down through the sacrum. So this is about halfway through your rib cage, um, uh, like right at the bottom part of the shoulder blade, and you just go straight over. That's where it attaches and goes all the way down. If you notice, we have this big, gorgeous white piece here. This is part of the thoracolumbar fascia. This is going to help to give stability to our upper body, because if you look at the skeleton, the only thing that's connecting that's really giving stability to the upper body, you have the spine, which is just an axis point, and the muscles that surround it really give stability, which is one of the reasons why low back pain is an issue for most people. But that thoracolumbar fascia, this plays a pretty big role in that thoracolumbar fascia and goes down and gives some stability to that low back. Then it kind of goes up and then around, and it attaches up here at the arm. And so it does cross that shoulder joint. So we are going to have a lot of shoulder movement. Now, um, this muscle, the big movement that this muscle is going to do is going to be shoulder adduction or adduction. This is going to bring your shoulder down. So we are going to also have a little bit of rotation, and then also a little bit of extra extension in that arm. So if you have that arm out, if you notice, this is the motion that butterfly swimmers use and breaststroke swimmers use. Uh, and that's one of the reasons why this muscle gets to be fairly large. It also does extension or extension, hyperextension. Um, so, oh, it doesn't want to show it. Okay, let's go back. Oh, there it goes. So we have extension, hyperextension. So when you do have swimmers, they're doing freestyle that pulls back and then up and over. So this muscle is really, really widely used. When you have tension in this muscle, you can get mid back pain. So uh, let's stop that motion so I can kind of show you on the body. So you have mid back pain. So it's going to be right about here where the traps overlap the lats. And then also over here on the side, you can get pain over here on the side, depending on the side that the tension is on. This muscle is addressed fairly thoroughly, especially when you get somebody, a massage therapist, who curves over the side and then brings their hands up that side and into underneath the shoulder, kind of into the armpit. This is going to uh, form part of that back wall or the posterior wall of the armpit area. So really good muscle that we typically work as massage therapists. You get one main area where a lot of tension does happen is like right in here, and let's see, I'll use a pen, and so like right in here you'll have a lot. Sometimes you'll get a trigger point or you'll get a knot in this area, and that's one of the areas that refers pain here into the back and then down here. But this is an overlooked, like this area is fairly overlooked. We hit this area quite a bit. So I hope you enjoyed this version of Muscle Monday. This is your Latissimus Dorsi, and join us next week for more.